H1N1 or the swine flu is cause for concern, but not for panic. Only one swine flu death has been reported in Oklahoma, a man in Kay County last June. Because the virus is spreading so broadly, the state health department has stopped tracking the number of people who have contracted swine flu. Most of us are concerned and have questions about the infection. So we interviewed Dr. Darren Brannon, a pediatrician at the Children's Center, who recently attended the International Swine Flu Conference in Washington, D.C.
The most important thing is just the fact that we have so much more going for us this pandemic than the United States had in 1918. You know, we've got a very involved public health system, and we also have the ability to create vaccines. Certainly one of the things that came out of the conference was the ability for mass production of vaccines in a very quick manner. Symptoms that are similar between both the H1N1 and the seasonal flu are a temperature of 100 or greater, sore throat, you can have cough, congestion or runny nose, headaches, body aches and pain, fatigue. But the two symptoms that appear to be unique to H1N1 is the vomiting and diarrhea. Not everybody has that. The other thing that's, I think, unique is that as many as 40% of patients that have symptoms may not have fever. So the absence of fever doesn't mean the absence of infection. In infants and young children, the earliest symptom may be something as subtle as a decreased appetite. The idea primarily for prevention is just that, covering your cough and sneeze and washing your hands. Just as soon as the flu shot is available, make sure your child and everyone in the household gets it. The best thing is to get them to understand what a germ is. You know, a germ is something that causes disease, that makes you sick, and it can be transmitted through coughing and sneezing, putting your hands in your mouth after you've had it on a surface, touching knobs and different areas where the public comes in contact with. These are areas where you're likely going to get germs. And those germs, if you bring them to your nose or mouth, you can actually make yourself sick. We've not seen a very large number of deaths with respect to H1N1 when we compare to the seasonal influenza. The seasonal vaccine, which is available right now, you should get it as soon as possible. The H1N1 probably won't be out for another 5 weeks or so. You should get it as soon as possible. The initial groups that will be targeted for the H1N1 vaccine are going to be pregnant women, are going to be the people who are in contact or are taking care of children from 6 months to 24 years, the healthcare and emergency personnel, as well as individuals who are 25 to 64 years that have chronic medical conditions.